patient, and I know it's pretty rare in any country where you practice, to have a dream patient with so much bone and so much tissue. I think it's obvious to you that you can use a flapless approach, or what we call a punched approach, without reflecting a flap, because you pretty much have enough tissue on the buccal and the palatal in this case, and you know that you'll have good tissue architecture and you'll have a great result no matter what. And we have a CT scan, but it's very hard to miss the bone. The bone is quite significant in this case. So this case is really set up for success. And you're looking at about more than 2 to 3 millimeters of available tissue. Now, if you choose a flapless approach, your patients will have less pain, and for shorter periods of time, your procedure will be much faster, much cleaner, a lot of fun to do. And the guideline that I'm using is that you need to have between 2 and 3 millimeters of good soft tissue, meaning good attaching keratinized tissue, around your implant in order to be able to do a flapless procedure, in order to do a flap or punch, a flapless or a punch approach. Now, if you look at this case, it seems like there's a lot of tissue, and it's actually, there is a lot of tissue, but I wanted you to take a look at the details, and that's very, very important. A lot of us are looking at the ridge as one unit, almost in 2 dimensions. But if you start at the mucogingival junction and you look at the line where the buccal aspect of the ridge transitions to the occlusal part of the ridge, you can tell that maybe we don't have as much tissue as we thought in the beginning. Okay, so I'd like you to look at ridges now a little bit differently, not in 2 dimensions, actually in 3 dimensions with a buccal and occlusal component. And when I say 2 to 3 millimeters, it actually refers to 2 to 3 millimeters from the transition line between the occlusal part and the buccal part. I hope this is pretty clear, okay? So in this case, we can definitely place an implant that is in a safe distance from the transition line, okay? Quick tip, very simple, but it's going to make a big difference when you perform your implant surgery.